Hello, and thank you for joining us today for the webinar titled Role of LIMS in Overcoming Biorepository Operational Data Management Challenges. I'm Shunali Paul, COO at CloudLIMS.com. I'm here to moderate this event. Dr. Stephen Haynes, the manager of the Sheffield Bio Repository, is joining us today as the presenter. Sheffield Bio Repository is a part of the University of Sheffield's Medical School. Following Steve's graduation in 2003, he began his career as a scientist in the water industry. Taking the opportunity to return to scientific research, he became a sequencing technician, and then in 2012, the manager of the university's core genomic facility. These past 4 years, he has been the manager of the Sheffield Bio Repository, responsible for human tissue storage and related HTA compliance, while also maintaining his other technical roles at the university. Steve, I would like to extend a warm welcome to you. Before we get started, I'd like to go over a few points so that you know how to participate in today's webinar. All attendees are in mute mode throughout this webinar. This is an interactive webinar, so we encourage you to ask questions anytime during the presentation by entering them in the chat box. The questions will be answered during the Q&A session at the end of today's presentation. We will take as many questions as time permits. Due to time constraints, if we are unable to answer your questions today, we'll answer them offline. It is time now to hand over the floor to Steve. It is over to you.
I'm Stephen Haynes, Core Facility Manager of the Sheffield Bio Repository. Today, in this webinar, we'll be looking at the role of LIMS and how we can use it to overcome operational data management challenges in a biorepository environment. Our talk will look at what biobanks are, the role these biobanks can play in research. I'll give you an introduction to our biorepository here in Sheffield. We'll look at what the data management challenges are that we faced and how we overcome them with a rollout of a LIMS system that could meet our needs. And then I'll actually speak about the benefits of a cloud-based LIMS implementation in particular. Now we'll look at what are biobanks and how do they relate to a biorepository. A biobank itself is a distinct collection of tissues and the associated research data that goes with those tissues. Now, the role of the biorepository is to house these collections and to keep the tissues in a safe physical location where researchers can query the tissues and can access the data associated with these tissues. Now, a biorepository itself, or the collections of biobanks within it, can range in size from one freezer to an entire freestanding entity of collection of rooms, perhaps a virtual biorepository that's spread out across an institution. Or indeed it's a bank that's part of an institution as a whole and their entire collection is effectively part of that biobank. Now, to run this effectively, we have to employ professional staff that commit to maintaining the specimens and also maintaining the associated data so that the records can be accurate, can provide continuity, and we can provide researchers with the suitable tissues and reliable information to go with those tissues. What exactly do biobanks store? Now, the biobanks that we're talking about specifically here are ones involved in medical research, because our biorepository itself is part of a medical school. But indeed, a biobank can store a range of biological samples that could be involved in like a museum, for instance, with historical samples, or agriculture with agricultural samples. But in particular, the biobanks that relate to human study can store several types of samples, and these can range from blood, serum, plasma, urine, to parts of entire tissue, tumour samples, etc. And as we've mentioned, we store that alongside the data derived from these samples. Now, the data derived from the samples can vary, but usually it will include clinical history, which can have information on the lifestyle, clinical and environmental data of the human participants and the biospecimens that we've derived from those participants. We can have information on demographics, so we'll look at patient demographics, including age, gender, ethnicity, geographical location, etc. We'll look at the family history, so we can pull together health information over many generations from the grandparents, parents, their children. We'll look at what sample collection procedures were used, so we can infer the history of the sample and how it was actually provided to us, and how the processing might have affected the sample and what particular use it could be, depending on the processing that it's undergone. We'll also, importantly, to comply with regulations, we'll have information on informed consent. So the biobanks will be responsible for managing the consent of patients in order to be able to share the tissue resources and the information in compliance with the regulations that are laid down by either the Human Tissue Authority in the United Kingdom or other authorities, for example, the FDA in the United States. Having a closer look at what the role of the biobanks is in research, samples alongside clinical data facilitate identification of prognostic, diagnostic, and predictive biomarkers. This enables further looking into identification of relevant disease genes, improvement in the understanding of health and disease, looking at future opportunities to provide personalised medical care, and also new discoveries that can be used in drug development studies and work. This, in the long term, further benefits patients, national and international scientific research communities, improving current and future health of the population as a whole. Our biorepository in Sheffield was set up over 10 years ago to house all the collections in the medical school which fall under the Human Tissue Act. The Sheffield Biorepository itself is made up of a series of individual biobanks, looking at, in particular, bone metabolism, cardiovascular diseases, and also the Sheffield Institute for Translational Neuroscience has a vast collection of brain bank related material. We store for each of these biobanks a range of different tissue types, from blood, saliva, urine, lung samples, tissue membranes, ranging across the entire spectrum of human tissue samples. The biorepository has several types of different storage areas specific to the needs of each type of sample that we store. Our biorepository offers a secure, centralised storage location. We provide fully alarmed freezer units and facilities that are closely monitored by staff within the University of Sheffield Medical School 24 hours a day, 7 days a week. For individual storage requirements, we provide storage in proven cryogenic facilities. Now, these can either be -80 freezer banks or liquid nitrogen bulk tanks, -80 freezers which can each hold up to 20,000 2 ml samples, and liquid nitrogen tanks which are capable of holding up to 80,000 samples in each tank. We also offer a range of cold storage from 4 degrees Celsius to -20 degrees Celsius, and in addition have room temperature storage areas containing FFPE blocks, boxes full of catalogued slides, and also whole tissue storage location which contains tissues stored in formalin. The biorepository has many standard operating procedures. We make these publicly available on our website. They include methods for storage, distribution of samples, recording and reporting any accidents, any incidents relating to the secure storage of human tissue, and also the use of the software that we use to upload and store sample information and for data retrieval. There are several important factors one should keep in mind when sourcing or obtaining biospecimens from a biobank for research purposes. In particular, we need to look at the informed consent of the donors and what it allows us to do with these tissue samples. We need to make sure that we have NHS REC approval, or in the United States, IRB approval. And we need to make sure that these samples have been stored properly and the environmental conditions of the biospecimens has been maintained throughout the life cycle. So ideally we need a system that can record this information and ensure that any experimental data derived from these samples is reliable and can be published in journals without question as to the appropriateness of the sample storage. Other important factors to consider are whether a source of data is available that gives information on any clinical findings relating to the tissue, information on the surgery that took place, or any other observations required for clinical research that could provide an explanation for any experimental results derived from these tissue specimens. Additionally, proper sample management systems should be employed. Now, these will ensure the accuracy and reliability of testing and therefore can give confidence in clinical research outputs. Once again, turning back to our specific case in the Sheffield Bio Repository, we're going to look at the data management challenges we faced. In 2015, we were storing more than 300,000 human tissue samples received from various researchers over a number of years. Managing this huge number of samples, along with the data associated, was becoming both a tedious process and enormously complicated. We were facing a lot of challenges. Maintaining the biographical information for samples coming in every day, along with the samples being distributed through the entire life cycle using only spreadsheets, was becoming error-prone. Meticulous record keeping was essential for each and every stored sample in order to serve the customers and the researchers' needs on time. Additionally, the data has to be kept confidential with a full audit trail in order to meet university standards and regulatory compliance from the HTA. To overcome these challenges, we had to start looking for a reliable LIMS system to track samples within the biorepository. Finally, we began analysing the benefits of cloud-based software against on-site solutions to find the best application that could cater for our needs. With cloud-based software, we thought that the characteristics, such as not needing large-scale infrastructure requirements, minimal product maintenance costs, the ability to employ remote disaster recovery, anytime, anywhere access, and extensive scalability of a cloud-based system was both ideal and cost-effective for us. After thorough consideration, we decided to go and implement the CloudLIMS system for this purpose. In contrast to our previous use of Excel and our old implementation of an older version of a LIMS system, we were able to implement role-based functionality within CloudLIMS, whereby we could assign specific designated tasks to various members of staff and use the program itself to assign user rights with different categories for samples, storage, testing, package and shipment, and the service and billing modules. Using the LIMS to address these challenges, we're able to keep track of all activities performed along with a date and timestamp, which provides us with an audit trail functionality that can meet our internal and external auditing needs. We are able to maintain a chain of custody and have electronic signatures that are easily configured to comply with data protection laws within the United Kingdom, and also could meet 21 CRF Part 11 in the United States and beyond. Given the challenges we face, implementing a reliable LIMS system to address them was seen as all important. As we're managing such a large number of samples, we had to plan on a LIMS that was scalable. With CloudLIMS built-in configuration module and the ability to automatically map headers, we're able to upload all our samples seamlessly from existing Excel files in very little time and following standard storage assignment procedures. We're also able to track things such as freeze-4 samples, visit numbers for each sample we log in, and integrate that into the data and produce a quality system with reliable information for the long term. With the advanced search capability of this LIMS system, we've been able to assign tasks to various different technicians based on sample types. For example, what we've done is taken all of the cell lines stored in liquid nitrogen throughout our medical school and store them centrally. We can then use technicians from individual departments to retrieve those samples and handle fresh deposits of new samples within specific research groups. All of this is facilitated using the CloudLIMS system. Another benefit is that the system allows us to filter records and create tailored reports for presentation. Now, this is important because we handle such a large number of samples from many different groups. So we can look at producing reports for those individual groups and also financial information depending on the number of samples coming in for each individual study. Finally, we begin to look at the benefits we've gained from implementing a cloud-based LIMS system. After deploying CloudLIMS, we were able to benefit by, first of all, avoiding the initial huge infrastructure investment. Other systems we looked at required investments of nearly $50,000 in the first year to get them up and running. Using the program's universal uploader, we were able to import all our legacy data of over 300,000 samples in a time frame of less than 2 years. Now, previously, we'd attempted to catalogue and to organise this data, but we found the task continually eluded us because of the number of new samples coming in and the requirements to meet regulatory rules on the samples meant that we just simply couldn't keep up with it. We were able to manage user permission and audit trails, which again is necessary to comply with human tissue authority regulations. We've also been able to reduce the time spent receiving samples, tracking the information, and also retrieval times for finding samples because of the search capabilities offered in the CloudLIMS system, which make retrieval so much faster than it was in the past for us. Furthermore, with cloud-based LIMS implementations, we've been able to easily upscale the biorepository operations. So we've been able to take in new collections of tissue and expand. So we're now on target to store upwards of 400,000 samples, and we're adding 100,000 samples every 3 to 4 years to our collection at current rates. We've been able to ensure data integrity and formulate reliable backup and disaster recovery plans. We've centralised the storage of the research sample tissues across the medical school for human tissue cell lines, human cell lines. So as I mentioned, we're able to delegate roles to individual technicians from the departments to look after these cell lines that we've stored centrally and kept the information within the CloudLIMS system. Overall, the CloudLIMS implementation has achieved cost savings, reduced environmental impact through increased efficiency, and provided vast fidelity for sample storage data. Thank you very much for listening to this presentation. My contact details are available on the Biorepository website, and contact details for CloudLIMS are available on this slide. Please direct any questions relating to this to the sales@cloudlims.com email address, or any questions relating to biorepository activities in Sheffield to myself at the University of Sheffield. Thank you.
Thank you for the presentation, Steve. We are now going to begin answering the questions submitted during today's presentation and the ones we received by email. As a reminder, you can still submit questions through the chat box. We have a number of interesting questions, so I will move straight into these. So the first question we received by email was about freezers. During the presentation, you have mentioned that you have SOPs in place for your freezers going down. So the first question was about, if your freezers go down, what backup plan have you adopted at your biorepository so that the sample integrity is maintained?
Oh yes, okay. So our main backup, I guess, is we have CO2 backups on all the freezers. So we do have a backup for a few hours if a freezer goes down, but they're also constantly monitored and linked to a call center. So we have probes which would send an alert out, and we immediately get a phone call or a text message. And then because of the CO2 backup, we maybe have a period of time, which, as I say, is usually about 5 or 6 hours to get to the freezer. If we can fix the problem, we'll fix it. Otherwise, we transfer it to a backup unit.
I see. So the next question that we received was by Savita, which was, how much time can we store formalin samples?
I guess I'd answer that with it depends what you're looking to do as your research on the formalin samples. I mean, I know that formalin samples that have been stored in museums, you can do deep genome sequencing on them after many decades, but it would depend what you're after, what nucleic acids or what you wanted to extract from them. But as long as they're as long as they were prepared well, they should store for quite a long time. But yeah, I just consult basically on the method of extraction you use to get your protein or your nucleic acid out of the formalin sample, and then yeah, so that would really affect how long you could store it safely. But I'd just check with the providers of the extraction kits.
So your answer actually brings us to the next question very beautifully, which is what quality assurance guidelines do you have in place at your biobank?
Okay, so we are linked very closely with the National Health Service, so we tend to follow the good clinical practice guidelines within our biobank. And we're also governed by the Human Tissue Authority here in the UK, so we also adhere to all their guidelines as well. And of course, we have internal university guidelines to follow.
Okay, so there is a follow-on question for your backup mechanism, wherein you mentioned that there's a call center where a call is received. So you mentioned a call center that rings you in the event of a falling cryogenic freezer. Is that an outsourced call center? And if so, where is it? That's one
Yes,
of the questions we just received. Sorry.
So yeah, this is a company called Tutela Medical. So we have the Tutela system installed, and they come and service the probes, and it's linked to a wireless internet connection. Yeah, so that they have a center that monitors the freezer temperatures, and they phone with an alert if a freezer goes down.
I see. Okay, the next question that we received was, do you also run cohort or population studies at your biobank? Because you're doing this long-term storage of tissue samples and multifarious samples for a long-term storage. So any studies that you run for research, because that is the primary objective of a biobank.
Yeah, I mean, so yeah, a lot of us. So we actually house a number of biobanks. So the cardiovascular biobank has a pulmonary hypertension study, and that's been going for a number of years. And they'll track patients when they come in for visits. So everything in our biorepository, we record the visit number, so we can track individual patients over time. Also, we've had studies in the past, sort of large-scale studies as part of the bone biobank, for example, and they did a very large study in, I think it was way back in 1999, and then a follow-up study in 2006, where they took a large number of samples from osteoporosis patients, and again that was all tracked over time and linked back. So yeah, we do have a lot of those sort of longitudinal studies over time with different cohorts.
Thank you. So we have another question on ILTDS, which is asked by Stephen. He asked whether do you have an ILTDS for all samples from consent through data collection through receipt and research use? In other words, do you have a fully auditable chain of custody?
We have audits, but we actually, I guess the biobanks themselves operate as independent research units. So they collect the samples as part of maybe clinical researchers in individual groups, and they submit them to the biorepository. So they all maintain their sort of individual records up to the point where we receive the samples. So the auditable part for us is the storage of the samples, and the audits, I guess, would be individual to the biobanks for the consent and for the collection of the samples. But they are all audited, but it's not integrated, because I guess the answer is because our biorepository isn't fully integrated, because we house a number of individual biobanks in the biorepository.
I see. Then the next question is on sustainability, that what measures have been used at your biorepository for sustainability?
Does that refer to environmental sustainability or?
I think financial sustainability as
financial
well.
sustainability.
Yeah.
So for financial stability, we have introduced small charges that were introduced probably about 4 or 5 years ago. So we do charge a small charge annually for new samples that come in. But the main charge we levy is for accessing samples. So we charge an access fee basically to pay for staff time to go and retrieve the samples from the biorepository. So those are the two main sources of income. If we do need to provide any processing services as well, we charge for those services too. But the main one is the retrieval access fees that we levy for accessing the samples within the biobanks.
Unfortunately, we are almost to the hour and the time is up for today. And we are unable to take any further questions at this moment. However, we'll reply to your questions as soon as possible. And I would like to thank you all for joining us today. Have a great day ahead or a great evening ahead, depending on where you're joined in for. Thank you.
Okay, thank you very much.